Hello, everyone. Welcome to Med School Moments. My name is Dr. Matthew Momjian, and today we're going to be discussing how to effectively use medical school learning resources. In today's episode, brought to you by MedSchoolCoach, you'll learn how to navigate and identify the most valuable medical school resources available to you. You'll discover how to differentiate between high quality and less effective or lower quality study materials. And you'll understand the best practices for integrating these high-yield, high-quality resources into your study routine. So, medical school learning resources are abundant and overwhelming and continue to grow every year in this digital era of education, which is a great bonus for us as a medical student because it means that there's so much material that you can draw on and learn in the best way possible. But it can also feel really overwhelming because it's not possible for you to get through all of it on your own. So you have to pick and choose which ones you think are valuable to you. When trying to assess the value of different resources, I usually like to think about them in 3 different types of categories. And you're going to want to try to cover at least one resource from each one of these categories to develop a well-rounded library of resources that you can draw on to excel on your coursework. So the first category of resources broadly is those that help you to learn content. So this includes things from your school, like in-person and recorded lectures, textbooks, and outside resources like Pathoma, AMBOSS, Boards and Beyond, First Aid, and many more. When you're trying to make this decision, you're going to have to decide how much weight you want to put on your school's internal resources and how much time you want to spend doing external resources for content as well. So if your school does a good job of mirroring boards type material in your exams and the questions are written in a way that's similar to what it will be on step 1 and step 2, using your school's material and lectures may not be as helpful for you. Because if your school's exams are very similar to step 1, then you can use a lot of these more external recordings such as AMBOSS or Boards and Beyond and First Aid that are tailored to step 1 and allow to help you to really prepare for those board exams as well as possible. This can also be the case if you're at a pass-fail school. Even if they have in-house exams, if you're in a situation where you're at a pass-fail school where your preclinical grades are not accounted for at all in your residency application, then you might be able to get good enough by using the external videos and then take the test by just reviewing the internal PowerPoints as well. If you're at a school that really prioritizes in-class lectures and has questions that are more designed towards those lectures and or they have graded preclinical coursework, you may want to prioritize more your school lectures and PowerPoints in order to make sure you're getting as many points as possible. Ultimately, you're going to have to discuss and consider the quality of your school's materials, how related they are to board's material, and what your school is actually testing you on in order to determine which method is going to work best for you. The next type of resources that I usually look at is resources that help you to memorize details. So not so much for learning, but helping you memorize raw facts or things that you just need to remember. So some of the options in this category are Anki flashcards, memorization video sources like Sketchy Micro or Sketchy Farm or Pixarize. And the goal of these is to help make it more efficient to help you to remember all these random facts you're going to have to learn to do well on your board exams and your medical school exams. I always recommend for memorization, try to use external existing resources like pre-made Anki cards, pre-made flashcards, Sketchy, Pixarize, because this will save you a lot of time from having to make your own memorization material. Some people like flashcards more, some people like videos more. So try both of them early on and see which one sticks better for you. For me, for example, video sources like Sketchy and Pixarize worked so well for me that I focused almost exclusively on those. Even now, having not watched them for a couple of years, I can still vividly remember so many of those Sketchy Micro scenes, and I do refer to them very often when I'm working with our clients. But you may be different. Maybe for you, Anki and flashcards are a much better route. So give them both a try and see what really helps stick for you. The third type of material, so we talked about learning new material, we talked about memorizing raw facts and material. Now we're going to look at resources that help you test and apply your understanding of that material. Some things in this category include school quizzes, school practice exams, and question banks like AMBOSS, UWorld, USMLE-RX. These are really helpful because they help you get practiced and proficient early on of how to apply the knowledge you know to practice questions in the same style that you'll be asked to do on step 1. I generally recommend, and what I did is saving UWorld for when you're in your dedicated board study period, and use another question bank like USMLE-RX or AMBOSS throughout your preclinical years to help you synthesize and integrate the material for your coursework, and then use UWorld during dedicated as a second pass and to make sure you're really feeling confident on the material. So in summary, I recommend selecting at least one resource from each of these categories. For the first category, learning content, a lot of people will have to use 2 sources, such as in-house lectures and a book or video series. But don't do like 3, 4, 5 from each category. It's just going to overwhelm you and you're not going to be able to learn any one of them well. You're not going to have time for all the resources in med school, and you don't need them either. Any 1 or 2 of these resources I mentioned from each category will serve you well in learning what you need to know. I also mentioned, try to figure out and experiment with some different resources early on. Learn what method works best for you. Talk to classmates, talk to upper class students, but ultimately you need to try some different methods and figure out which one allows you to perform as well as possible and allows you to learn and apply what you need to know. I'm Dr. Matthew Momjian, and this has been a Med School Moment, brought to you by MedSchoolCoach. If you want more personalized advice, scan the QR code on screen or click the link in the description to book a free consultation with our enrollment team. Your path to becoming a physician is important to us.